Hey guys, Dr. Craig Mortensen here again. So today we're covering part two of the three-part series of my webinar here on how to finally heal your gut. So today is definitely going to be more on the technical side of things. We're going to be going over labs and physical exam findings and things like that that are going to lead us down the digestive health maze, if you will. There's a lot of different things we're going to be looking at. So I'd recommend get a piece of paper, get a pencil or a pen, take some notes, and hopefully you'll catch some information along the way here. So I'm going to go ahead and start sharing my screen. Okay, so you should be able to see my my story little picture here. So I want to real quick just go over my story, and this will give you a little bit more information of who I am and how I got to where I am today and why I do what I do. I'd also encourage you go on to Google, read the reviews, watch some of the video testimonials of some of my clients and patients, and see if this is kind of a right fit for you. And if you have any questions, feel free to shoot me an email or to give my office a call. So my story is when I was about 12 or 13 years old, I started getting these stomach aches. And they would start off fairly mild, and over a period of about 12 to 24 hours or so, they would just progressively get worse and worse and worse. And they got to the point that they were so excruciating that I would just be curled up in a ball on, in my parents' bathroom at the time, just hugging the toilet and just throwing up, and I would not stop throwing up, and it would be so bad that I'd get to the point where I'd become so dehydrated I couldn't keep anything down, and the pain was so bad that all my joints would just curl up and just be like contracted because my muscles were spasming. And at that point, my dad would have to, pick me up in his arms, and they'd, put me in the car, and we'd go off to the emergency room, and they'd pump me full of all kinds of, IV pain medications and fluids and all this stuff to kind of get things to relax and to decrease the inflammation and help with the pain and all this stuff. And initially, it wasn't too bad because it just kind of started off with, maybe every 6 months, once a year or something like that for about a year. And then these stomach aches, and I don't still quite know what exactly it was, they would become more frequent. So it got to the point where I was getting them about every 2 to 3 months, and they were just excruciating. And nobody could figure out what was going on. I went to all kinds of GI doctors, had upper GIs, lower GIs, endoscopies, colonoscopies. I think I had some CTs of the lower abdomen and things like that, trying to figure out what was going on. And all the traditional medical doctors could tell me was that, oh, you've got inflammation. Well, duh, right? So no surprise there. So, it kind of got to the point, and I remember I was probably around maybe 15 years old or so, and I remember thinking that, let me turn this off of screen share right now. I remember thinking that, even at that age, man, this is bad. This isn't something I can continue doing, because each time I would be out of school for about a week, and then it'd take me a week of recovering at home, and then I'd go back to school and I'd be, way behind, and everybody'd be asking like, oh, what's going on? You all right? So I was kind of embarrassed at the time. And the pain alone was enough for me to kind of say to myself, man, I don't really want to continue like this. This is bad. So my mom at the time, or not at the time, my mom brought me to a natural doctor who was kind of at the forefront of what is now called functional medicine or functional healthcare. And he was able to help me restore my health and get me back to the point where now, I didn't have, it took me about 2 years, but he helped me restore my health to where I didn't get those stomach aches anymore. I still have a sensitive stomach now, but I don't get those stomach aches. I'm healed. I watch what I eat and I take care of myself, and those issues are no longer, thank goodness. But that's kind of what led me down the path of natural health and functional medicine and just kind of that whole arena. So that's my story. It was I definitely would not want to go through that again, and I would not wish that on anybody because it was miserable. But all of our trials and tribulations make us who we are, and that experience or experiences has really made me into who I am today. So that's my story. So let's do screen share again, and hopefully this is screen sharing. So let's go on to the next slide. Okay, so what is functional medicine? And this is more what I like to call functional healthcare. So, and again, I'm kind of looking off to the side here because I've got my camera here and then my second screen over this way for when I do, the webinars and online consulting. So, functional healthcare or practice, it is defined as medical or healthcare practices or treatments that focus on optimal functioning of the body and its organs, usually involving systems of holistic or alternative medicine. Functional medicine or health looks to address the root cause of disease. So we don't really want to just cover up the symptoms, which sometimes you do need to have symptomatic relief, right? Things are really bad, you need to calm things down, but then you really want to look at, okay, what's the source of the issues here? And that's what we're looking at. Okay, so I had to pause it for a second to make sure I was actually screen sharing. So now I am screen sharing. So this is the technical definition. And again, I like to refer to it as functional healthcare. I don't necessarily like the word medicine because that's not what I'm doing. It's alternative healthcare, right? I don't, yeah, so anyway. Okay, on to the next slide here. So, say what? Right. So this is a great way of thinking about it. So think of as your health as kind of this top part here, right? And these are the symptoms that we can get. These are the root causes. So think of it as like this. If you've got if your health is a tree or your body is a tree and you've got some of these issues going on, let's say you've got high blood pressure, and instead of a nice green color to the leaves, your leaves start turning brown. And that's just maybe your symptom is high blood pressure as a result of that. Think of it like this, is if you take medications, it's like taking a spray can of green spray paint and spray painting those leaves green, right? It's temporarily covering up. It's not fixing anything. In fact, a lot of times it can cause other issues. So what I'm more concerned about with are these bottom things down here. What are some of your underlying issues that may be causing or contributing to your high blood pressure, heart disease, or allergies, or your autoimmune, or whatever the case may be? That's what functional medicine, functional healthcare is about. And what is the real cost of intestinal pain? So this doesn't take into account any of the other issues that can happen as a result of GI dysfunction. So we're not talking about autoimmune, we're not talking about thyroid, we're not talking about anxiety or depression, any of that stuff. This is just intestinal pain. What does it cost? So in the last 15 years, there's been a 74% increase in the rate in IBS. That's approximately 10 to 15% of the population. There's 1.4 million people with Crohn's. There's 700,000 people with ulcerative colitis, and 1 in 20 people will get colon cancer. As of 2014, 74% of the population is living with some sort of GI pain. And these things are not cheap. So let me give you some numbers real quick. Crohn's, the estimated annual cost of somebody that has Crohn's is $19,000. If you have ulcerative colitis, we're looking at $15,000. If you have IBS, we're looking at approximately $11,000 per year in medical treatment costs and all the stuff that's associated with that. If you have colorectal cancer, God forbid, chemo, we're looking at $36,000, and if you happen to have surgery, that's an additional $32,000 on top of that. So it is way cheaper to get and stay healthy through natural means if you can, right? By any and all means, do this stuff before you have to go and get some, major chemo or surgery on some things. So your health is your greatest wealth, and it really is priceless, right? So take care of it, because money, if you're sick, if you're not feeling good, or if you're dead, money doesn't mean anything. And we come back to this WED that we talked about in our first webinar. So really think about this. These are some of the symptoms of just intestinal pain. And just be aware that your body is very intricately related or tied together, so you can't separate one system of the body from another. And here's another great saying by Hippocrates: it is more important to know what type of person the disease, or what type of person has a disease, than to know what type of disease a person has. And that kind of goes back to genetics and epigenetics and familial tendencies and things like that, which are really important to look at. But we're not going to be getting that in this this seminar series. That's a little bit too complicated for to go over in a short amount of time. But again, here's the key point: all disease begins in the gut, right? So don't forget you are what you eat. I need to eat a skinny person. So let's go back here again. Again, I want you to think gut. We're thinking brain health, 50 to 60% of all your neurotransmitters. We're thinking immune system, 60 to 70% of all your immune system is made in the gut. We're looking at the gut as a core behind inflammation, and it's also end-stage detoxification, which is elimination. So if you're not eliminating right, it's going to mess up a whole bunch of stuff, which we'll get into that a little bit. So what were we talking about? Now, I'm not going to go over the drugs just because there's it's a slippery slope, and I can get up on my soapbox here and really go on for a long period of time about this. But just know that none of these drugs are side effect free. They all have their costs. So before you go on this stuff, really be aware of what you're doing and why, and exhaust all your other options. Granted, there are definitely times when you need to do this stuff, but try to minimize it. Crohn's, this is a great example of the progression of medications that people go on when things aren't working. So at first you go on anti-inflammatory meds, right? So let's try to control the symptoms. When those don't work, then they put you on corticosteroids, and then you get this list of symptoms that happens here. And anybody that has Crohn's and they're not doing some other diet, lifestyle, nutritional stuff in addition, you are going to go through this list. And eventually you'll end up on immune system suppressors. And really it's just all about symptom control at this point. And you can see some of the side effects. So liver and kidney failure, infection, increased risk of tuberculosis, TB, and increased risk of cancer, right? You're suppressing the immune system, so your immune system is not going to be working to be able to fight off those cancer cells. So when we're looking at assessing your digestive health, this is the model that you need to follow. So the first couple stages are really gathering. We're gathering information. And in the functional medicine world, or functional healthcare, we use often the acronym GO TO IT. Turn my phone off there. So at first we're gathering. We're going to do a complete history, look at your symptoms, your physical exam. Then you're going to order testing, and that's where we're going to go over. We're going to go over your testing. What are the tests that we need to look at to assess your digestive health? Then you're going to tell, right? Let's go back through those and let's kind of tell you what's going on. We're going to organize and put a plan together, and then we're going to initiate. We're going to initiate that plan and work it for a little while, and then you track it. How are you progressing? How are things doing? And then you repeat that cycle. You can't just get on one, okay, I'm going to do this, right? And then you do that and expect it to take care of everything, because there are steps that you need to follow along the way to be able to fix these things. So let's look at some of the physical exam findings that are very common with digestive issues. And these are not exclusive to just digestive issues, but if you've got any of these things, I pretty much guarantee that you've got some digestive issues. Okay, we're back. So we're looking at any type of skin issues, right? If you have dry, itchy, bumpy, or red skin, if you're getting hair loss, brittle nails, cuts, scrapes, and bruises that won't heal, you've probably got some nutritional deficiencies. If you get the ridges on your nails, so if it's like ridges that kind of go this way, then there's probably some digestive issues going on. Or if you're getting ridges the other way, or if you've got little white spots on there, horizontal lines, if you get pain or tenderness in your stomach, pretty obvious that you digestive issues going on. A patchy tongue, so if you've got kind of white splotchiness on your tongue, or like what they call a geographic tongue, or candida, or yeast, things like that, pretty sure sign. Right? If you get athlete's foot or fungus that won't go away, or like a jock itch all the time, digestive issues, yeast infections, UTIs, itchy anus, multiple allergies or food intolerances. If you get a ring around the iris, okay. So that ring around your eye is kind of part of what is called iridology, and that's kind of an ancient Chinese art, pseudoscience. It's not something I use exclusively, but it's nice to kind of correlate with other things that you find. Or if you're getting blood or stool in the blood or mucus in the stool, pretty sure sign that there's something going on in the digestive system. Okay, moving on. Okay, so this is what. Let's go back. This is why we're testing. If you don't know where you come from, then you don't know where you are. If you don't know where you are, then you don't know where you're going. And if you don't know where you're going, you're probably going wrong. So we can't just assume certain things, because then you're going to waste time, you're going to waste money, you're going to be going in circles, you're not knowing if you're making any progress. You have to test and be able to measure where you're at and where you're going and the progress that you've made, so you can know how much longer you have to go or what else you have to do along the way. So some of the tests we're going to be looking at are, first you start off with a blood test. So routine and specialty. So just regular blood, right? You go to LabCorp. I have a certain blood panel that I like to send my patients for. It kind of gives us an indication of overall health and how you're doing. And then from there, depending on what we find on that, it's going to lead us down different rabbit holes. And some of these rabbit holes are going to be a stool analysis. So it'd be a CDSA, which is a comprehensive digestive stool analysis, GI effects, parasitology in the stool analysis, and possibly microbiology. So that's looking at what's your good and bad bacteria levels. Right? We also have breath tests, so we're looking at H. pylori and SIBO, and then there's urine tests that we can do. We're looking at digestion end products, leaky gut, infections, toxins, and we can also look at hormones that way as well. So when we're thinking blood tests, this is looking at the basics, right? We want to make sure we're getting water, air, and nutrients. If our body is like a tree, let's make sure we have the basics before we start getting too detailed. I get a lot of clients and patients that come in, and they have, maybe they had a genetic test done with another doctor, and they're so concerned about this gene that it's causing all their issues, right? It's the bane of their existence. And yet we do a blood test and we find that they're anemic. Well, if you're anemic, you're not going to really be feeling all that great. So why don't we take care of that first, get you feeling a little bit better, and then we can start working on a little bit more detailed stuff. So this is a blood test, and this is some of the main things that I look at on the blood test that are going to indicate how your digestive health is doing. So when we're looking at your A1C, so this one right here, that's looking at how well are we digesting our carbohydrates and how well are we using those. The BUN and the creatine have to do with how well your kidneys are functioning. So if we're looking at detoxification, we got to make sure that you're clearing those toxins out. Sodium and potassium are really important. That can also indicate how your adrenal glands are doing. CO2, that will tell us a little bit about, is your system more acidic or basic? Protein, if your protein gets too high, it can indicate that you're dehydrated. If it's too low, then it can indicate that maybe you're not breaking down and digesting your protein as well as you should, which a big part of that is HCl, or hydrochloric acid, right? Stomach acid, which I'll explain a simple test that you can do at home that will test that a little bit. We're also looking at alkaline phosphatase, AST, and ALT, which are liver enzymes. We want to make sure, as well as other skin, liver, bone, placenta, things like that. And then we've got the iron, the ferritin, TIBC, and percent transferrin saturation up on the top right here. So that are your anemia markers, right? It's really hard for the body to heal if you're not getting oxygen. Well, oxygen is carried by your red blood cells and iron. And then we've got your cholesterol, your lipid levels. We've got inflammatory markers, so this will tell us if there's a lot of inflammation in your system. And if there is, then, okay, we need to look at your gut somewhere. So CRP, homocysteine, fibrinogen, and homocysteine is also another one that is tightly related with some genetic variances. And then vitamin D. Vitamin D is really one of the most important hormones or vitamins or minerals, not minerals, vitamins in the body. And we always want to make sure that's optimal, or else you're going to have a hard time healing. So here's an example of a stool analysis. And this is a basic one by Genova, and they do a good job. And this is who I use most of the time. They break it down into 4 different categories. We've got digestion, absorption, your metabolic markers, and then your microbiology. So the digestion is basically, are you digesting your proteins? Do we have any undigested proteins that are showing up and through here? It indicates how are your stomach acid levels. And then when we're looking at absorption, these are primarily fats. Are you digesting and absorbing your fats? Or you're not absorbing any and are they just going kind of through your body? Your metabolic markers, and one of the most important ones that I like to look at is your beta-glucuronidase right here. And we'll talk a little bit about that. And then what influences all of this stuff is your microbiology. So we've got the good bacteria here, additional bacteria, which has the possibility or potential to be pathogenic. And then we have the mycology. So this person has, of the good bacteria, 2 of the 3 aren't even present, right? And then we've got additional bacteria, all at +4. So generally I like these at +2 or below, and I like these ones at +3 and above. Now if we're looking at your mycology, everybody has a little bit of candida and yeast in their body. If it shows up, then you've got too much, right? If you look close enough, you're going to see it. But this person has, I think this was a follow-up on this person. This person actually started off at a +4 on their candida and yeast. And this person had had candida for 20 years and wasn't able to get rid of it. And multiple rounds of antibiotics and all kinds of crazy stuff. So this is, I think, 6 or 9 months kind of after initiating care on her. And she's down to a +1, and she's doing so much better. It's amazing. But this is what you want to look at on a stool analysis. A stool analysis from the hospital or the like Quest or LabCorp. All they're looking for the most part, is either going to be pancreatic elastase, which is a digestive enzyme, and blood, right? If those things are normal, and the blood is looking for colon cancer, if those things are normal, then they're going to say, oh, you're fine. But they're missing a huge part of everything. And then a parasitology, which oftentimes will include a parasitology. If you've been out of the country, if you've been eating raw, uncooked food, if you've got pets, certain jobs, if you've eaten at food trucks, things like that. And then when we get to beta-glucuronidase. So beta-glucuronidase is an enzyme, and elevated levels are associated with up to 5 times, so 500% increased risk in colon and breast cancer in people that have high beta-glucuronidase. And I'll explain this right now. So what happens is, this is how detoxification happens or works. So you've got toxins circulating around in your system, and it goes through the liver through 2 phases of detoxification. So phase 1 and phase 2, and both of those phases are dependent on these nutrients here. So what phase 1 essentially does is taking that toxin, let's say you've got a T for toxin, and it basically changes the shape, or it activates it, or makes it, let's say it activates it, so, or it changes the shape for simplicity's sake. Now the problem with this is now active, and this is called an intermediate metabolite. This is the reason we take antioxidants, is because it's very reactive, right? Free radicals, and it causes damage. So we want phase 2 to go really fast so we don't get a buildup of this stuff. So phase 1 changes the shape. Phase 2 basically conjugates it or attaches something to it, makes it water soluble, so now you can excrete it out of your system. And then it gets excreted either through bile in the feces or the urine in the stool. What beta-glucuronidase does is it's a deconjugator. So it does the opposite of phase 2. So this bound or conjugated toxin, it breaks that bond essentially. Now you get this toxin that's in your stool or in your bowel and your colon circulating around doing a bunch of damage, right? So that's why that's a really important marker that we look at. Okay, SIBO, small intestinal bacterial overgrowth. And this is actually, in mine and a lot of doctors' opinions, a wrong terminology. It really should be small intestinal bacterial translocation. Because what happens is, so you've got the small intestine, and then you have the large intestine. So large intestine is usually where all that, the bacteria is, the good and the bad bacteria. And SIBO doesn't have to be a bad bacteria. It can be good bacteria as well. So there's a sphincter right here that prevents the backflow from the large intestine into the small intestine. So if you've got too much bacteria, good or bad, or if you've got dysbiosis, it tends to essentially weaken that sphincter right there. And that bacteria can move from the large intestine into the small intestine. And we can actually test for that. And this is the test. So you drink this solution and then you blow into this thing and it measures the amount of hydrogen and methane that's produced, and depending on what your levels are and when it shows up, right, so here's the times, 20, 40, 60, 90, we can figure out where in your small intestine is that bacteria showing up and how much. So it's a really great test. It's really easy. You know, sometimes you might have some
it's 2 o'clock.
Bad side effects essentially from it because you're kind of drinking a sugar solution, which kind of contributes to the bad bacteria in there. But you know, sometimes it's a necessary evil to figure out exactly if and how bad your SIBO is, and then we can use it to monitor how you're doing as well. Okay, leaky gut. I'm not going to explain leaky gut too much, but just kind of more how to test it. Leaky gut is basically, if this is the barrier of your intestinal wall, and normally the cells should be nice and tight like this. When you're constantly bombarded with allergies or food sensitivities or toxins or whatever the case may be, bad bacteria, basically weakens these proteins that hold those cells together, and then those proteins break. It creates these junctions here, or these gaps, and now you can get all this foreign particles into your system, and this is essentially what causes or contributes to autoimmune issues, right? If you've got all this foreign material getting in your system that normally shouldn't be there, and now your body starts reacting to it, starts overreacting to everything, it starts attacking yourself, and it just kind of creates this vicious cycle. So that's why we say if you have autoimmune, you have leaky gut. If you have leaky gut, you have or will get an autoimmune disease. So leaky gut, if you've got digestive issues, nutritional deficiencies, diarrhea, constipation, gas, bloating, poor immune system, skin problems, food allergies and sensitivities, and any autoimmune disease, yep, you've got leaky gut. Now, the testing for leaky gut is pretty cool. So the old test was a lactulose mannitol test. And what you do is you drink the solution and then you essentially measure how much of different ratios of that solution came out in your urine. That would tell us the permeability or give us an indication of the permeability of your intestinal wall. That is kind of the old way. And this is kind of what that test would look like, or part of that test result. The newer way is an occludin-zonulin test. So remember back on that leaky gut, we've got these proteins that are holding these cells together. Occludin and zonulin are those proteins. When those cells essentially break apart, those proteins get released in your bloodstream and you can actually measure those. So very cool. So this kind of goes back to if you have autoimmune, you have leaky gut. There's a thing called allergy or food-induced, or allergy, food intolerance-induced autoimmune disease. So that has to do with those food allergies and sensitivities constantly bombarding your intestinal wall, irritating things and breaking it down, and then causing leaky gut, and then that leaky gut causing or contributing to the development of autoimmune, because now you're getting so many other particles into your bloodstream that you normally wouldn't, that you're overreacting to it. So it's actually very cool how that all works. Maybe it's a little bit morbid, but I really enjoy it. So it's very cool. So can we fix it? Yes, we can. Right, for all you parents out there, Bob the Builder. I got really tired of that. Follow directions. So this slide is not showing up for you guys, it looks like. So it's a little minion guy, and he says, when I get a headache, I take 2 aspirins and keep away from children, just like it says on the bottle. So when we go over the 5 steps in the next series of this webinar, just know that there is a method to the madness, and you can't skip around. You can't do things out of order. You're going to mess yourself up. For example, I get a lot of clients that, you know, everybody's told them, oh, probiotics are good or prebiotics are good. They can be, but they're step 3. You have to go through step 1 and step 2 before you even get to step 3, or you're going to make these things worse. You're just going to perpetuate the problem, and you're going to say, oh, probiotics didn't work for me. Well, yeah, you're doing it at the wrong time. So all this stuff has a certain way that you should do it. So follow instructions. So on the next webinar, we're going to be going over the 5 steps you need to follow. So stay tuned in, and I look forward to giving you this information. Again, if you have any questions, if you have any issues, shoot me an email, give me a call at the office here. I'll be happy to talk with you. And in the meantime, I'm Dr. Craig Mortensen. Be healthy, be happy. Stay tuned in.